Today we will discuss about an editorial article which is published in the Indian Express with the heading Plugs the Gap in TB Drug Supply. The author is suggesting that the drug shortage could jeopardize the success of the government's anti-TB campaign. So before we delve into the topic, let's see what is a tuberculosis is. The TB is an infectious disease which is caused by bacterium Mycobacterium tuberculosis. So it is actually in the UPSC prelims examination, sometimes the question may ask that the TB is caused by either virus or bacteria. Now we have to understand that it was infected with the bacteria, and that bacteria name is Bacterium Mycobacterium TB. So you have to remember that. So this actually primarily affects the lungs, but it also can spread to the other parts of the body such as kidneys, spine, and also brain. So the TB is transmitted via the airborne particles, where an infected person is generally, when he is doing cough or when he is sneezing, the other person will get affected with this. And if you can see the global and Indian scenario, the TB remains a significant public health challenge in the worldwide. So even though the India is recorded a significant progress, it is able to achieve an 18% decline in the TB incidence and 25% reduction in the TB related deaths over the past decade. But the target is we have to eliminate the TB by 2025, where actually we are going to miss the target, because right now whatever the TB incidents are there, TB deaths are there, they're far away from the original target. The original target was by 2025 we have to eliminate the TB from India, but that is not possible. But still we have made a significant progress, and if you can see the numbers also, there is in the TB incidents we have seen 18% decline, in the TB deaths we have seen 25% reduction. So India is doing a significant progress, but we failed to eliminate the target of zero TB cases by 2025. So that is not achieved till that was not achieved, and it may take some time. So it depends upon how fast the government will respond to the current scenario. And if you can see the positive developments in TB fights which is happening in India especially, even the World Health Organization also highlights that India has made the significant progress in combating this TB, and it clearly mentioned that there is an 18% decline and the 25% decline in the TB related deaths. But the question here is, we missed the targets of the TB elimination. So originally India has to achieve the target of eliminating the TB from its soil by 2025. That is not possible. And let us now see what are the various challenges which are hindering India's fight against the tuberculosis. The first and foremost challenge was incomplete treatment adherence. As we know that TB treatment is a long process. Everyone has to go with full course of the treatment, but most of the people, they will not go for full course of the treatment due to various reasons. Because initially when they start to use the drug, they will feel some kind of the relief. They may feel that the TB was completely off from their body, but that was not true. So everyone has to go for the full course of the treatment. That is not happening with respect to the TB patients. And interruption in therapies also increases the risk of drug-resistant TB, because we are giving, for example, we are giving one drug to one particular disease, and if you are not able to complete the entire course, what will happen was the bacteria or virus which is in our body, it become the resistant to the drug what we are taking. So we need to see that if you can go for the full course of the whatever the therapy is there, then that TB or any disease will be completely eliminated from the body. But if you are using the course for just 1 week or 2 weeks, and if you are not following the long-term therapy, our body will become drug resistant to TB. So even though if you can take the TB medicines later, the TB will not be eliminated from our body. So this is the first and foremost challenge, the incomplete treatment adherence by the people who are receiving the therapy. The second important thing was drug supply shortage and management issues. We know that health is a state subject. The center has to coordinate with the state to remove any kind of the health emergencies. So even though we know that TB is such a significant disease, still we are able to see that significant drug supply shortages, especially in the states like poor states like Jharkhand, Bihar, Uttar Pradesh, and some of the states actually. It is very difficult for the health departments to put a lot of efforts to get the medicines for this TB and to supply the same to the vulnerable communities. That is not happening. So erratic drug supply due to inefficiencies in the procurement, because even though the people are there to make the medicine, the government is not able to procure it properly based on their what we can say budget issues. So this kind of the procurements delay and this type of the distribution system delay is also one of the significant impact why the people are not able to get the treatment of TB effectively. And the third important factor is there is a high disease burden is there. We know that India population density was very high. So obviously when one person is affected with TB, there is a high possibility that most of the people in or around him is able to also get the TB, because we cannot criticize the Indian health system and Indian what we can say hygienic things, but most of the times Indian is not following the some kind of the hygienic protocols. For example, when we are sneezing, we are not using the proper protocol so that other person will not disturb. And when we are using handkerchief, we are not going to use it, we are going to use it continuously without washing. There are so many things are there where it is very easy for this type of diseases to spread very fast. So India is account for the highest TB burden globally, making the disease management is very difficult. And even the people who are actually facing the disease, they does not have enough kind of the information with them how to control it, how to stop the spread of the disease. So that is also one of the important factor. The other important factor for the government is impact of the COVID-19. So during the pandemic, actually, the detection of the TB and also treatment efforts to curb the TB also disrupted actually. So because most of the health resources they completely diverted to the COVID-19 pandemic. So the attention was shifted from TB detection to the COVID-19. It is not only applicable to the TB. Many of the diseases, they're not able to get the enough attention as the COVID-19 gets, because the COVID-19, it become the health emergency. So most of the health infrastructure, the whatever the resources are there in the health management, everything was shifted to the COVID-19. So in that process, actually, the TB detection and the treatment efforts are also disrupted. The another important factor was late diagnosis by the people. We know that the rural India, actually, the most of the village peoples, whenever they are having some kind of the problem with their health, they simply go to the local store and they will put some medicine without any proper diagnosis and prescription. They will use it. Because of that, they may find some kind of the relief, and that undergoing disease will be there actually. So when they are facing a tough problem, when they will come to the cities and they will go to the multi-specialty hospitals, then they're able to detect exactly how big the disease was. So initially we are not able to diagnose the TB actually effectively. Now here we have to see the two things. One, because of the availability of the drug supply in India, most of the people are able to get the medicines at an affordable cost at the local price shop. But the problem here is most of the medicines are available for the non-prescription stage also. Because if you can go to the medical shop and if you can ask a particular medicine, and 90% of the time he will give the medicine without prescription. So that kind of the system is existed. That is the reason why most of these type of the small cases actually where we are able to control at the initial stage, we are not able to control it. We cannot only say just because of the availability of the drug supply. The problem is diagnosis policy also. Because the government, because of the limited government infrastructure and because of the very costly treatment and diagnosis effects of the diseases like TB, most people are not able to go to the diagnostic centers, and they're not able to afford the whatever the diagnosis is there, and they're not able to pay the price for the diagnostics actually. So if the government comes forward with the system, like if they are able to screen from their level, at least for the people who are in the below poverty line, they're able to diagnose this disease in a much advanced compared to the what is happening right now on the ground level. So that is to be very much important. That is also one of the reasons why we are not able to eliminate TB. The important other factor is drug resistant TB. Already we have discussed about it, because India is one of the capital to use the antibiotics. Most of the people are using antibiotics for every disease. Even if you can see from the childhood itself, if the child is not feeling well and if he is having some fever or something else, for the 3 to 4 more days, we are immediately apply the antibiotics. For most of the diseases, when it is in the when if your home remedies are not applicable properly, then we are going to the antibiotics. So if you are continuously using antibiotics, the diseases like TB, it is also indirectly we are giving one more more antibiotic to the body. So the body is already becoming the antibiotic resistant. So by the time if you are giving TB drug for that body, the body is not able to function effectively. So we already became drug resistant. So government has to take enough attention. Even the health practitioners have to take enough attention to make sure that the prescription of the antibiotic should be as less as possible. Unless there is a significant requirement, they should not definitely advise the antibiotics for the people. The other thing is healthcare infrastructure gaps. We know that the current public health system is overburdened and also underfunded. So we need to increase the public health infrastructure, and we have to increase the percentage of the funds which is there in the union budget. Since last 3 to 4 years, there is a significant impact is happening. 2.8 to 3.2% of the union budget is allocating to the health department, but in our sense actually that is not suffice. At least we have to increase the spending of the health infrastructure to 3 to 3.5%, if it is possible to 4%. Even though the ideal scenario is 6% of the total budget, at this point it is not possible. So at least 4% to be expected to the healthcare sector. That will actually give a lot of boost for the healthcare infrastructure. The other thing is the socio-economic barriers, because when we are using antibiotics, obviously you have to come with the proper nutrition. But if the poor people is getting the TB and they are taking the TB treatment, and because of that poverty, they are not able to fulfill the nutritional content. So because of that malnutrition and lack of proper housing, it is also contributing to the spread of the TB. So that is also one of the main barrier for the Indian government to eliminate TB. The other factor is lack of community engagement and awareness. Actually, the stigma around TB was when the people are affected from TB, the society wants to make them alienate from themselves, and they're actually giving a special treatment for them. It is not the special treatment for the health point of view. Just they're giving that. No one is able to care about the people who are really affected with the TB because they have a fear that they also get that disease. So that type of the stigma should be avoided. And if we are taking the proper health measures and if you are taking the proper protection measures, the TB will not spread. And we have to take extra attention that the person who affected with the TB has to initiate himself that I was affected with the TB, and so that the individuals are also able to understand that what is the consequences of the TB, and they'll also be a little more careful compared to that. But most of the people, when they have certain diseases like HIV or TB, they will not interested to tell them to the outside, to the public, because the society will not treat them as equal people if they know this factor. So that type of the stigma also has to remove from the society. So that is very much important. The other thing is policy and program implementation challenges. Even though India have national TB elimination programs, largely these programs are managed by the state health infrastructure. So the states has to come forward, and there should be enough coordination between the state and central health resources, so that together they are able to remove this TB from the India. And if you can see the other various issues, we know that there is an issue with the drug supply, and also government's response are also is very poor, by citing some reasons like the reasons are unforeseen and the extraneous circumstances. By citing these type of reasons, the government also is taking a back seat in combating this type of the diseases. That was not good actually, if you can see the health future of India. The other thing is impact on TB treatment is there, because if you can see that the number of authorized TB centers are very, very less, and there is a shortage also. The trained people are there, and mostly the TB is affected for the people who are in the lower income group. Now, if the TB is affected to the higher income group people, they are able to combat this type of disease by using some kind of the treatment methods. But if it is coming to the lower income group people, they are not able to face this treatment, because the treatment in the multinational hospitals for the TB was much higher. But the current existing government infrastructure was limited, so that they cannot accommodate more people. So lower income groups are most affecting, and even if you can see that if you belongs to the lower income group people, and their density where they are living also much higher. For example, Mumbai slums we are seeing, and some SC/ST slums are also we are seeing in the our states also, because if they belongs to the lower income group, they will have much less land. If they have much less land, they have to construct one building, and almost all 10 to 12 family members, they have to stay in the same building, and the next building also just adjacent to the existing building. So obviously, the lower income group people are suffering more with respect to this TB issue, because they are not able to control the combat, and also they are not able to control the spread, and they are not able to afford the treatment. All this together is combinedly affecting a lot of people in the lower income group. So government has to come forward in such a way that diagnosis can be done from the government side, medicine should supply from the government side, enough health infrastructure and monitoring system should be monitored by the government side. If these steps are to be taken care of by the government, obviously even the lower income group people also, we are able to reduce the incidences of the TB in future. The other thing is health risks from the therapy interruptions. Now, for example, if I am affected with the TB, I am going to the hospital. Then the doctor will prescribe certain treatment. The treatment will go for 6 months, and first 1 to 2 months I'm able to afford the treatment. From the third month, if I'm not able to afford the treatment, then there is an interruption in the therapy. So if there is an interruption in the therapy, we already discussed that the drug resistant TB strains will develop in the body. So even though if you want to continue this treatment after 3 to 4 months, by that time the TB drug resistant strain is there in the body. So whatever the tablets or medicine injection what you are taking into your body, that is not showing much effect on the TB strain which is there in your body, because already you started some kind of the treatment for the 2 months that a drug was fighting against the TB. And if you can use the same medicine for the next 2 to 3 months, completely that TB strain will remove from your body. But after 2 months you stopped your medicine, then whatever the TB strain inside is there, it is able to understand the mechanism of that antibiotic, and it is able to develop a strain which is going to fight against the antibiotic which you are taking. So that is also very dangerous. So we can reduce the risk of the TB only by the antibiotics, but you should not give the enough breaks in the treatment. So if you are giving enough breaks or interruptions, obviously the efficiency and efficacy of the program will be reduced. So that is also one of the important thing. And we can see that if you can see the entire India, the best state in India for eradicating TB was Tamil Nadu. The Tamil Nadu is one of the best performing state to fight against the TB because of the so many reasons are there. Let us see what are the various reasons which allows Tamil Nadu to combat this TB very well. And also the model of Tamil Nadu is example for the other states which are affecting predominantly by the TB. The first and foremost thing is the Tamil Nadu has strong public healthcare system, because in most of the Tamil Nadu government hospitals, they have a strong diagnostic centers are available, and even the Tamil Nadu government is clearly maintaining some citizen charter in their hospitals also. For every diagnostic treatment, they are giving some time frame within 15 minutes or within 1 day, within 24 hours. They're clearly mentioning all those timelines in the public health infrastructure, so that the people who are going for the treatment, they well known about how much time it will take for the diagnosis. So Tamil Nadu has one of the best diagnostic centers in the public healthcare infrastructure. So that type of the strong diagnostic facility should be evolved in the other states also. The other important factor is there is a high detection rate is there in Tamil Nadu, because as we have the more diagnostic centers, it is obviously that there is a more diagnostic centers, more detection rates will be there. And if you have less diagnostic centers, obviously less detection will be there. So the Tamil Nadu is able to detect the TB cases in much advance compared to the other states, because of the early finding of the TB disease, and they're able to provide the treatment at early stages. So controlling any diseases at the early stages is very much easy compared to the finding it in the later stage. So that is also one of the important factor which contributed Tamil Nadu to fight against the TB. The third one is community outreach and awareness. The Tamil Nadu actually, the health programs includes community engagement to reduce stigma and also to encourage people to seek treatment. We already discussed, if one person is affected with the TB, the society stigma is completely different. If you are not able to remove that stigma, it is very difficult actually to encourage the people to come forward and to go for the diagnostic, and if they are diagnostic with respect to the TB, and consent treatment should be given. So if the people are not coming forward, first of all, for the diagnostic centers, there is no point actually. So we need to reduce that stigma. That stigma is possible only when you go for the community outreach programs. So Tamil Nadu is doing one of the best community outreaching programs, so that the people are not able to fear about TB anymore. They are able to voluntarily come to the diagnostic centers, and they are testing with respect to the TB, and if they found with respect to that the same disease, and the therapy is started immediately for the people of the Tamil Nadu. So this kind of the community outreach programs also has to be implemented by the other states. The other thing is effective implementation of national TB program, and the Tamil Nadu is very good in the use of the technology, because they have some digital health tools actually to monitor and to track the patients of the TB, so that they are going to conduct more community awareness programs in those areas to reduce the effect of the TB to earn and to spread the TB furthermore. And the one more important factor is focus on the nutritional support. The Tamil Nadu has a scheme called Nikshay Poshan Yojana. So the Nikshay Poshan Yojana is able to address the malnutrition in the Telangana below poverty line, and also to the some sections of the poverty line people, above poverty line people also. The Tamil Nadu patients, especially the TB patients who are the TB patients under this program, they're receiving additional support. So Nikshay Poshan Yojana is a normal scheme which is available to provide the nutrition food to the Tamil Nadu people. But if you are affected with the TB under the same scheme, that is Nikshay Poshan Yojana, you are going to get the additional nutritional support. So you are getting the normal nutritional support under this scheme, and if you are affected with the TB, you are getting additional. So which means we already discussed that if you want to combat a TB, the proper nutritional support is very much important, because you are taking antibiotics. Obviously, whatever the food you are taking, that should be nutritional food you have to take. But the below poverty line people, they cannot afford the nutritional food. So now what happens was, because of the schemes like Nikshay Poshan Yojana, the Tamil Nadu is giving lot of attention to give more nutrition support to the TB affected people. This is also one of the best scheme. The other states has to follow this type of the programs. And the Tamil Nadu is giving lesson for other state, because the Tamil Nadu demonstrate that early detection, seamless drug supply, community involvement, and integration of the TB programs into primary healthcare systems are very much critical to eradicate TB. Let's hope that all the other states also will follow the same, so that we are going to eliminate TB, maybe not in 2025, maybe by 2027 or 2028. We aim to eliminate the TB from the Indian health infrastructure, because if you are not able to eliminate the TB, that is the most dangerous disease to spread very easily, especially in the lower income group people. So we need, at least from now, we need to give the enough attention to remove the TB from India, because according to the original target, by 2025 we have to eliminate the TB from India. Now we are not able to do it, but still our efforts are progressive in nature. Even World Health Organization also told that India is in the right direction. But even at that point of time, we are able to remove the TB entirely from India as promised previously, because the world took a challenge that by 2025 they want to eradicate TB from the world. But India is also committed that, okay, fine, by 2025, we are also going to eradicate the TB from our country. But that not happened. But still the efforts are in the progressive stage. Let us see that the states has to act proactively, and they have to coordinate with the central government to make sure that drug supply and everything to be on time, so that the supply chain management should not be one of the reason actually to fight against the TB. So good supply management and good procurement and the policies like Tamil Nadu state is very much important to combat the TB prevention and TB propagation and TB spread in the country. So we assume that by 2028 at least we are going to eradicate the TB from India.